So this lesson is going to talk about diabetic ketoacidosis, or DKA. Now, diabetic ketoacidosis is a state of severe hyperglycemia with ketoacidosis. So this is essentially an acute exacerbation of type 1 diabetes mellitus. Now remember, in type 1 diabetes, the body has no insulin. Now let's remind ourselves, normally here's the cell, and the cell can use two things to get energy. One is glucose, and the other is fatty acids. Now, normally, in order for the cell to use glucose, it requires insulin. It gets the insulin, brings the glucose into the cell, and the cell can create ATP, or energy. If the body has no insulin, the body has to find another way to get to this energy, and so it uses the fatty acid route to try to create energy. The problem is that that method has a byproduct, and that byproduct is called ketones, which are acids. So without the key to get the glucose into the cell, the body has to go around and it ends up creating all of these acids in the process. It's kind of like a burglar. You know, the door's locked, there's no key. So what does he do? He's going to break a window. So that process is called gluconeogenesis, breaking down the fatty acids, and we end up with this buildup of acids in the system, leading to a severe metabolic acidosis. It's usually sudden onset, and it can be triggered by stress, infection, or patients just not taking their insulin. Or it could be a medication issue if they're not taking it, or if their insulin pump malfunctions. I've seen that before. Then that can lead to DKA as well. So what are we going to see? Well, we're going to see two main sets of problems. First, we're going to see hyperglycemia. We're going to see elevated blood glucose levels of between 400 and 600, maybe even higher than that. I've actually seen it quite high. That causes that severe hyperosmolarity, where the fluids are going to shift because there's so much blood sugar inside the vessels and it's so concentrated. Fluids are going to shift out of the cells and into the bloodstream to try to balance it out. So that leads to severe cellular dehydration. Okay, so patients are going to become thirsty, they're going to become hot. And then all of that fluid that's now in the vessels is going to go to the kidneys, and it's going to get dumped because the kidneys are not only dumping all that fluid, but it's also dumping sugar into the bloodstream. So we're going to see glucosuria. That sugar gets dumped from the kidneys into the urine, all the water follows, and you end up with polyuria. Now, that dehydration is also going to cause their BUN and creatinine to go up. It can also cause an altered LOC because of cellular dehydration in the brain. Okay, so they're going to be dry, hot, confused. They're going to be peeing a lot. They might be thirsty. And we're going to see this super high glucose level plus the positive ketones. So that second set of problems is due to the ketones, that ketoacidosis. Their pH is going to drop below 7.35. Their bicarb may drop below less than 22. And then we're going to see the positive ketones coming out in their urine. This is one of your classic signs of DKA, in addition, of course, to your other lab values. And we're also going to see fruity breath. That's those ketones that make their breath smell fruity. And then Kussmaul respirations. Why Kussmaul respirations? Well, this is when they breathe really fast and really deep breaths. They look really uncomfortable, actually. Why are they doing this? Well, they're in acidosis, right? So their body is trying to blow off that CO2 to try to decrease the acidosis and bring their pH back up. It's trying to do that as fast as it can. Problem is, patients can only breathe like this for so long. They're going to get really fatigued. They're going to get worn out. And then finally, we're going to see hyperkalemia. This is a result of acidosis, and it's another one of the body's attempts to balance out those electrical charges. So acidosis involves hydrogen ions, right? They're a positive. Potassium ions are also a positive. So when we have way too much hydrogen, the body's going to start kicking out the potassium into the bloodstream to try to compensate for this problem and balance all of that out. So the problem is, we know how dangerous hyperkalemia can be for our patients, right? We've got lots and lots of cardiac issues there. So what are our priorities for management of DKA? Well, of course, we want to identify and treat the cause, especially if it's an infectious source, we can start getting rid of that. But our number one priority is to correct the acidosis. The only way to really do this is to give IV insulin therapy. Remember, the only insulin we can give IV is regular insulin. Not only is this going to bring the blood sugars down, but it's also going to let the body know that it's okay to stop using the fatty acids, stop making ketones. So sometimes we'll actually keep giving insulin even after their sugars come down because we need to keep working on decreasing that ketone production and getting that acidosis reversed. So we'll just give them sugar to balance out that process. Now, our second priority is going to be to replace the lost IV fluids. Remember, they have polyuria, they have cellular dehydration, so we still need to address the fluid situation. We want to monitor their LOC, monitor their respiratory status. Remember, they can get really tired with all that heavy breathing, and they can have some neuro changes, so we want to make sure that we keep them safe. Many patients end up requiring intubation and ventilation just because they wear out and they can't breathe well anymore. And then, of course, we're going to monitor our lab values. We're going to monitor our blood sugar. We're going to monitor our electrolytes. We're going to monitor our blood gases so we can see where our pH is. And then this is usually an anion gap acidosis, so we want to monitor our anion gap as well. So our top nursing priority concepts for a patient with DKA are first, acid-base balance, then glucose metabolism, and then fluid and electrolytes. We want to correct that acidosis, bring that blood sugar down so that the body knows it doesn't have to create ketones anymore. It doesn't have to go through the fatty acids anymore, and make sure we're replacing those fluids and managing that potassium. Make sure you check out the care plan attached to this lesson to see many more detailed nursing interventions and rationales. So let's recap. For DKA, it is an acute exacerbation of type 1 diabetes where the body is breaking down fatty acids for energy instead of glucose, and that results in the production of ketones building up in the bloodstream, leading to this severe metabolic acidosis. This can cause altered level of consciousness and Kussmaul respirations because they're trying to correct the acidosis. Patients are also hyperosmolar because of the excess glucose in that high concentration. So we're going to see what's called osmotic diuresis. That's when the kidneys are dumping all that sugar and the water is going to follow it. We're going to dump tons and tons of water and see polyuria and that severe cellular dehydration. So our number one priority is going to be to correct the acidosis, give that regular insulin IV, reverse that gluconeogenesis process so they don't have to make ketones anymore, correct that acidosis. And the number two priority is going to be fluid and electrolytes. Replace those fluids, monitor their potassium, and replace that as needed. Remember that insulin actually drives potassium into the cells. And so sometimes with intensive insulin therapy, we actually see the potassium level go down. So either way, we're going to monitor their potassium. We might give them a little bit of potassium in their IV fluids and try to keep that right in that special normal range of 3.5 to 5. So that's it. Those are the most important things you need to know for DKA. Now you'll see in the HHNS lesson that they're very similar, but the priorities are different. So make sure you check out that lesson as well. And don't miss all the resources attached to this lesson, including a cheat sheet on the differences between DKA and HHNS. All right, guys, go out and be your best selves today. And as always, happy nursing.